Bursa are thin sacs filled with a small amount of synovial fluid that are located near the joints in between the bones, tendons, and muscles. The function of a bursa is to facilitate joint movements with minimal friction or resistance. There are about 150 bursa in the human body, and when they get inflamed or just enlarged with excess fluid, we call this bursitis, even if inflammation is absent. Bursitis is a common cause of joint pain, but this is not arthritis because the joint itself is not affected. The bursa that are most affected are those near the large joints of the shoulders, elbows, hips, and knees. And three common causes of bursitis are trauma, infection, and crystallopathies like gout or pseudogout. The subacromial bursa sits underneath the acromion and deltoid muscle and on top of the humeral head and rotator cuff. Repetitive overhead movements, impingement, and rotator cuff tendinopathies can all affect this bursa. The olecranon bursa is located over the extensor surface of the olecranon, and it is very superficial. Constant pressure on the elbows, for example when resting the arms on a table or chair, irritates this bursa. The trochanteric bursa is located over the greater trochanter and the insertion tendons of the gluteus medius and minimus. It lies underneath the iliotibial band. Activities that irritate this bursa include those that involve hip abduction, such as running, jumping, climbing stairs, or cycling. Constant pressure over this area, for example in sedentary or bedbound patients, is another risk factor. The prepatellar bursa is also a superficial bursa located over the patella or kneecap. Repetitive trauma from kneeling is a common cause of bursitis here. You can easily diagnose any bursitis by history and physical exam alone. Patients typically present with pain and tenderness where the bursa is located. For example, in the lateral hip when the trochanteric bursa is affected, or in the anterolateral shoulder when the subacromial bursa is affected. Swelling may or may not be present depending on if the bursa is superficial or deep. For example, in olecranon bursitis, the appearance of a golf ball in the elbow is classic. But the trochanteric bursa will almost never cause swelling in the lateral hip when irritated. Only if the bursitis is caused by an infection or an inflammatory condition like gout will patients develop localized redness, warmth, or limitation in range of motion. Otherwise, these are not typically present in bursitis. On palpation, the bursa will feel like a small water balloon. It is soft, boggy, and compressible. If you are suspecting septic bursitis or a crystallopathy, you must aspirate the fluid to send it for analysis and cultures. In any bursitis, additional tests like X-rays or other imaging studies are not necessary unless you want to rule out other problems such as a fracture or arthritis. The treatment of any bursitis secondary to trauma includes rest and avoidance of the trauma or repetitive movements, applying ice, and taking non-steroidal anti-inflammatories. Physical therapy can help in trochanteric and subacromial bursitis. Steroid injections can also help, and surgical options like bursectomy are considered the last resort. If bursitis is secondary to an infection or a crystallopathy, the treatment is very different. For septic bursitis, antibiotics and surgical drainage or bursectomy might be needed. Refer your patient to an orthopedist in this case. Bursitis secondary to a crystallopathy is also managed differently, but you will learn about this in another lesson. And now that you can recognize bursitis, you can easily exclude this from your differential diagnosis of joint pain.
So I hope you liked this video. absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Med Mastery can help you become a great clinician, make sure to watch the About Med Mastery video. So thanks for watching, and I hope to see you again soon.